In this lesson, we'll cover what it means to create and maintain a safe environment for both patients and staff. Patient safety is at the core of nursing care, and it's everyone's responsibility. Let's start with the National Patient Safety Goals, created by the Joint Commission, the organization that accredits and evaluates healthcare programs in the United States. These goals are updated regularly to tackle common safety risks. They include identifying patients correctly, improving staff communication, using medications safely, using alarms safely, preventing infections, identifying patient safety risks, preventing surgical mistakes. These goals serve as a standard for safety in every hospital and care facility. Now, let's look at what can make a patient's environment unsafe. Some of the biggest risk factors are the patient's age or inability to understand directions, impaired mobility, communication barriers, pain or discomfort, delays in assistance, and malfunctioning or poorly placed equipment. Even something as simple as a bed being too high can lead to a fall. To promote safety, we start with fall risk assessments. Every patient is evaluated on admission, and if they're at risk, they get a special armband, and a sign is placed in the room. We can also use tools like bed or chair alarms to notify us if a patient tries to get up. Other strategies include placing patients near the nursing station, keeping the bed in its lowest position, placing an overbed table in front of a chair, providing frequent trips to the bathroom, offering food and drink regularly, and making hourly rounds to check on the patient. Simple distractions like music or back rubs can also reduce restlessness. Preventing falls may sometimes involve restraints, but they are always a last resort. We follow the principle of the least restrictive method, only using restraints when all other options have failed. There are strict rules for their use. A healthcare provider must order the restraint, specifying the type, reason, and duration. Orders are usually only valid for 24 hours. Once in place, the patient must be checked every 30 minutes, released every 2 hours, given fluids, toileting, and repositioning, assessed for circulation, sensation, and skin breakdown, and always closely monitored while the restraint is off. All of this must be documented properly on the flow sheet. There are several types of physical restraints, including mitt restraints to prevent scratching, extremity restraints to keep arms or legs still, waist and vest restraints to prevent patients from rising from bed or chairs. Remember, we don't use restraints to punish or control. They are used only to prevent harm. When it comes to fires, use the acronym RACE. R dash rescue, at alarm, C, confine, E extinguish. And for using a fire extinguisher, remember pass, P, pull the pin, aim at the base, S, squeeze the handle, S, sweep side to side. Facilities often use code names like Code Red or Facility Alert to signal a fire. Stay calm and follow your facility's emergency plan. We also respond to medical emergencies like CPR for cardiac arrest, the Heimlich maneuver for choking, rescue breathing when needed, and in major events like mass casualty incidents or bioterrorism. Every facility is disaster protocols. Be sure to know your local codes. Safety doesn't stop with the patient. We also need to protect ourselves. Start with good body mechanics. Keep your feet shoulder width apart. Bend your knees, not your back. Avoid twisting. Pivot instead. Hold items close to your body. Push or slide heavy objects instead of lifting. And always ask for help when moving patients. Avoid injury by elevating your work area and taking breaks. Fatigue increases the risk of errors, and don't ignore the reality of chemical, radiation, and biological hazards. Use standard precautions. Wash your hands, wear gloves, never recap needles, and report any exposure immediately. If you or a co-worker are struggling with substance use, seek help or report concerns confidentially. Safety always comes first. Safety is at the heart of nursing. Whether you're protecting a patient from falling, using equipment properly, or responding to an emergency, your actions matter. A safe environment doesn't just happen, it's created by you.